traumatic brain injury? What is traumatic brain injury? Traumatic brain injury usually results from a violent blow or jolt to the head or body. Mild traumatic brain injury may affect your brain cells temporarily. More serious traumatic brain injury can result in physical damage to the brain. What are the symptoms of traumatic brain injury? For a mild traumatic brain injury, the signs and symptoms may include loss of consciousness, headache, nausea or vomiting, fatigue or drowsiness, problems with speech, sleeping disorders, dizziness or loss of balance, sensory problems, memory or concentration problems, mood changes or mood swings, feeling depressed or anxious. For moderate to severe traumatic brain injuries, some signs and symptoms include convulsions or seizures, dilation of one or both pupils of the eyes, clear fluids draining from the nose or ears, inability to awaken from sleep, weakness or numbness in fingers and toes, loss of coordination, profound confusion, agitation, combativeness, or other unusual behavior, slurred speech, coma, and other disorders of consciousness. How do we recognize traumatic brain injury in children? Infants and young children with brain injuries might not be able to communicate headaches, sensory problems, confusion, and similar symptoms. In a child with traumatic brain injury, you may observe change in eating or nursing habits, unusual or easy irritability, persistent crying and inability to be consoled, change in ability to pay attention, change in sleep habits, seizures, sad or depressed mood, drowsiness, loss of interest in favorite toys or activities. What are the causes for traumatic brain injury? There are many causes like falls, vehicle-related accidents, violence and fighting, sports injuries, explosions. There can be many different complications from traumatic brain injury, including coma and stroke. Please consult a doctor immediately if you or your loved ones have had any injuries to your head and are facing any of the symptoms listed above. What is the treatment for traumatic brain injury? Treatment varies on the severity of the injury and other factors like risks and complications. Treatment includes medications, surgery, therapy, counseling. How can these injuries be prevented? Prevention is easy. We just need to make sure that we avoid risky behavior and falls. Some ways are: install hand rails in bathrooms, put a non-slip mat in the bathtub or shower, remove area rugs, install handrails on both sides of staircases, improve lighting in the home, keep stairs and floors clear of clutter, get regular vision checkups, get regular exercise. For children, use playgrounds that have shock absorbing materials on the ground. Disclaimer: the content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. It is important to remember that trained speech-language pathologists have many tools and techniques to help children reconstruct their feeding and/or speech powers.